Dear students, welcome back. In the previous session, we have discussed about the structure and function of the metacarpophalangeal joints of the fingers. Now, in this session, we are going to discuss about the interphalangeal joints of the fingers. So, this interphalangeal joints of each finger is having proximal interphalangeal joint and distal interphalangeal joints. Okay, each of the proximal interphalangeal and distal interphalangeal joints of the fingers is composed of head of the phalanx and base of the phalanx distal to it. That means, so the proximal phalanx head is going to articulate with the base of the distal phalanx. The same thing is happening in this distal joint also. So this is the middle phalanx. The head of the middle phalanx is going to articulate with the base of the distal phalanx. So this forms the proximal interphalangeal joint. So what are the bones articulating here? So the proximal head of the proximal phalanx articulates with the base of the middle phalanx, forms the proximal interphalangeal joint, whereas the head of the middle phalanx articulates with the base of the distal phalanx, forms the distal interphalangeal joint. Each interphalangeal joint, which is a true synovial joint, and it is a hinge variety of synovial joint. That means it is having 1 degree of freedom, that is the movements taking place in these joints are flexion and extension. Okay, if you see the ligaments, so the ligaments are almost similar to the metacarpophalangeal joints, that is one palmar fibrocartilaginous ligament that is called as volar plates, and 2 collateral bands. Here we can see the collateral bands here, 2 collateral bands on the lateral side and the medial side, which is running downwards and forwards, Okay, so these are the ligaments which are similar to that of the metacarpophalangeal joints. And what are the movements taking place in these joints? Flexion and extension. The flexion is brought about by flexor digitorum superficialis at the proximal interphalangeal joints, and the flexor digitorum profundus at the distal interphalangeal joints. Coming to the extension of these joints, that is interphalangeal joints, is brought about by the interossei and lumbricals. Okay, so now we will see in detail about the functions of these ligaments and some of the studies done by some investigators about interphalangeal joints, and also the range of motion in the case of interphalangeal joints from radial side to ulnar side. Okay, yes. And each joint, that is interphalangeal joint, is covered by joint capsule and also volar plate and 2 collateral ligaments. Okay, and the base of each middle and distal phalanx has 2 shallow concave facets with a central ridge. The distal phalanx sits on the pulley shaped head of the phalanx proximal to it. Okay, the joint structure is almost similar to that of the metacarpophalangeal joint, in that the proximal articular surface is larger than the distal articular surface, and unlike in the metacarpophalangeal joints, there is a little posterior articular surface at the proximal or distal interphalangeal joints, and therefore it can have only little hypertension. So these two joints exhibit little hypertension. The distal interphalangeal joint may have, this is the distal interphalangeal joint, may have some passive hyperextension, but in the case of proximal interphalangeal joint is not seen in most of the individuals. Okay, coming to the volar plates. So what is the function of volar plates here? The volar plates reinforce each interphalangeal joint capsules, especially on the volar side, that is anterior aspect, which enhance stability and limits hyperextension. So the main function, the same function is seen in the metacarpophalangeal joints also. It enhances the stability and limits the hyperextension. Okay, the plates at the interphalangeal joints are structurally similar to that of volar plates which are present on the metacarpophalangeal joints, but these volar plates are not connected to the deep transverse ligament, whereas in the metacarpophalangeal joints this volar plate is connected to the deep transverse ligament, and these volar plates are individually present in each of the fingers. Okay, and now we will see some studies regarding this interphalangeal joints of the fingers. Fisher and associates found fibrocartilage projections from the extensor mechanism. So normally the extensor mechanism we can see on the dorsal aspect, and this extensor mechanism is brought about by the extensor tendons as well as connections with the interossei and lumbricals. We are going to see this extensor mechanism separately. Just you have to understand that they found some of the fibrocartilaginous projections from the extensor mechanism to the volar plate, and the collateral ligaments attach to the base, especially to the bases of the phalanges at both proximal and distal interphalangeal joints are seen, and more fibers are seen in the proximal interphalangeal joints. Okay, in the collateral ligaments of the interphalangeal joints, function is not fully understood here by these investigators, and they describe to have a cord and accessory part similar to that of the metacarpophalangeal joints. So we have seen some accessory part and true part of collateral ligaments, isn't it? Like that here they have not described in a such clear manner in these two joints. Okay, now the stability is provided by this collateral ligament complex because some of the portions of these ligaments remain taut and provide support throughout the range of motion of the proximal and distal interphalangeal joints. Commonly, injuries are occurred to the collateral ligaments, mostly at the proximal interphalangeal joints, particularly in sports and workplace injuries, with a radial collateral ligament is more likely to be injured than the medial collateral ligament. So normally The radial collateral ligament is injured twice than the ulnar or medial collateral ligament. Some other investigators found the lateral collateral ligament of the index finger to be the strongest of the all proximal interphalangeal collateral ligaments. That means the lateral collateral ligament of the index finger. So if you consider this one is index, middle finger, ring finger and the little finger, the ligament, so that is here you can find the radial ligament. The radial ligament of the proximal interphalangeal joint is the strongest of the all proximal interphalangeal joints of the fingers. Okay. Whereas the fifth proximal interphalangeal joint is having the weakest collateral ligaments. And the relative strengths of the lateral collateral ligaments normally meet functional expectations because the thumb is most likely to oppose the lateral side of the index, creating varus stress at the proximal interphalangeal joint. So that means here thumb is obstructing this proximal interphalangeal joint not to do their work. That means it is creating varus stress. So varus means away from the midline. So it is creating varus stress at the proximal interphalangeal joint and least at the fifth proximal interphalangeal joints. Okay, so these are the studies done by some of the investigators or biomechanists. Okay, now we will see the range of motion of the interphalangeal joints. Okay, normally what are the movements taking place in all these interphalangeal joints? These joints are true synovial joints of hinge variety, isn't it? So that means it is having 1 degree of motion. Normally flexion and extension are available to all these joints. Okay, the total range of flexion extension available at the index finger is greater at the proximal interphalangeal joints is about 100 to 110 degrees than at the distal interphalangeal joint, that is 80 degrees. So the proximal interphalangeal joint flexion extension is maximum up to 100 to 110 degrees to the index finger, and this interphalangeal joint of the index finger, distal interphalangeal joint range of the index finger is 80 degrees. And the ranges for proximal interphalangeal joints and distal interphalangeal joints at each finger is going to increase. So all this, the ranges is going to increase from radial to little finger. So here it is 100 degrees or 110. So it is more than here in the middle finger. And the range is still more than in the ring finger, and it is still morely seen in the little finger. Okay, and the little finger is having the highest range or greatest range of motion at the proximal interphalangeal joints as well as the distal interphalangeal joints. That means the range of motion of flexion is going to increase from index finger to the little finger. So here if you can see at the little finger, that is at the ulnar side, so the fifth proximal interphalangeal joint is achieving 135 degrees of flexion at the proximal interphalangeal joint, and 90 degrees of flexion and extension is seen at the distal interphalangeal joints. Okay, the pattern of increasing flexion extension range of motion from a radial to the ulnar side of the hand is consistent at all the carpometacarpal joints, metacarpophalangeal joints, as well as proximal interphalangeal joints, and to a lesser degree at the distal interphalangeal joints. Okay, the additional range is seen more at the ulnarly located fingers, as well as the underlying bony arrangement favors angulation of the fingers towards the scaphoid and facilitates opposition of the fingers with the thumb. Here if you can see, the star mark is the scaphoid here, scaphoid tubercle, and with the flexion of digits to the palm there is a convergence, that means an angulation you can see here. So it is making some angle. Okay, because of this angulation, the obliquity is due to increased flexion mobility of the metacarpophalangeal joints and proximal interphalangeal joints from radial to ulnar side of the hand. So this kind of obliquity facilitates opposition of the fingers with the thumb. So the greater available range at the ulnar side also produces a grip which is very tight, and also having greater closure on the ulnar side of the hand. Okay, these are the main functions of increasing such a range of motions at the ulnar side, which helps in gripping very tighter and also greater closure of the objects. Okay, many objects are constructed so that the shape is narrower at the ring and small fingers and widens towards the middle and index fingers to fit this range of motion patterns. So we are going to study the types of grips separately. So this is all about the interphalangeal joint structure and function and the range of motions of these joints. In the next session we are going to discuss about the extrinsic finger flexors, how it is going to work, that is the mechanism of finger flexion, and later on we are going to see the intrinsic muscles, okay, intrinsic muscles of the hand.